Hi, Coach B.
Hello, Brenda.
Welcome to Let's Talk with Brenda. We are happy and we are so honored to have you here with us today.
It's my privilege and honor to be on the show. Thank you for inviting me.
Thank you. So, Coach B, today we are
Yes,
talking about surviving cancer and all that you've been through. You have been through it, so we would like you to share your story with us. So, before you share your story, can you tell us a bit about yourself?
okay. So I'm Bina Mathews, and I'm an executive master coach, communication consultant, and keynote speaker. I have lived in Dubai for, I think, 28, 29 years now. I'm here with my husband and my two daughters. And I was part of a program called Evolving Women, through which I met the amazing Brenda, which is a story for another episode by itself. So, yeah,
All right. Thank you so much, Coach Bina. And what was life like before the diagnosis? I'm sure it was just any other normal day for you. It was not expected. Tell us more about that.
absolutely, because there is no history of breast cancer in my family. I mean, my grandmother, maternal grandmother, had ovarian cancer. And my paternal aunt in her late 70s was diagnosed with intestinal cancer, but nobody with breast cancer. So it's something you don't see coming at all. And
Mm.
so life was good. Life was normal. Um, just worrying about the little health things that pop up. Excuse me, but no fear about this of all things. In fact, the a month before I was diagnosed, it was Pink October, and I was speaking at an event where I was speaking about how caregivers need to take care of themselves.
Mm.
And ironically, a month later, I made my family caregivers without being able to see that coming. Yeah. So that
Mm.
was before that.
So, was it like a routine checkup for you, or how did
Um,
it all start?
okay, so I have been doing an annual pap smear since I turned 30, because my mom made me because of her mom. So every year I would do that. I did a mammogram like 10 years ago, I think, but I would do a breast ultrasound every year. And there was nothing out of the ordinary, all good. So just before I did my routine pap smear, I had what seemed to be a UTI, urinary tract
Mm-hmm.
infection.
Mm-hmm. Yes, a
Very,
urinary tract infection.
yes, severe pain, blah, blah. My gynae was on leave, so I went to a new one. She did all the tests, and it turned out there was no infection. Couple of weeks later, repeat of it. By then, my gynae had come back, went to her, same thing, all the symptoms, but no infection. So
Mm.
she said, let's go ahead with the pap smears scheduled. And first time ever, the results came back as abnormal. So she said nothing to worry about, possibly because of this UTI kind of thing. But anyway, let's go ahead with the mammogram and ultrasound. So you know what one misses, the other catches. And that's how I went. And because I did look it up, and if you get this abnormal pap smear result, they do recommend that you do a mammogram. And then there was slight discomfort in the left breast, very slight. And then I checked, I got my husband to check, I got my gynae to check, and there was nothing that we could feel, no lump or pain in a specific spot. Anyway, so then I went and just did the mammogram, looked okay, walking out, and then the eagle-eyed nurse, God bless her, she says, just please stop. There looks like a speck on the left side. So
Mm.
let me repeat the left side again, just to be sure. And it turned out there was a speck. And so then when I went to the ultrasound right after that, the ultrasound doctor told me, this is so small and so deep, I may not
Mhm.
have found it without the mammogram results showing me exactly where to look, which is
Mm.
why an ultrasound by itself is not enough. So that's when I realized why they go on about a mammogram being necessary. So
Mm.
I quickly take the opportunity to urge anyone above 40 and anyone below 40 who has breast cancer history in the family to please do a mammogram. So, yeah, and then we did the biopsy, and it turned out to be malignant. So, at the time, it was less than 1 centimeter.
Okay.
So, international protocol is anything below 1 centimeter doesn't require chemotherapy. So,
Mm.
I fortunate not to have to undergo chemo before surgery. Now, between biopsy and surgery was 2 weeks, and in those 2 weeks, the tumor had doubled in size.
Wow.
So, at the time of the surgery, it was twice the size, so it had crossed one, become 1.2. So, post surgery, I had to undergo chemo. So, I did 16 rounds of chemo, and then
16.
16, yes. And then I had to do 20 rounds of radiation.
Wow.
So, yeah, that
That must
that
have
was
been hard.
it was, but not. I mean, it is one of the few solutions which proceeds to batter you while it's healing you.
Mm.
Chemotherapy, it's simultaneously curing you and ruining you at the same time. So it is hard. It is hard. But
Mm.
at the same time, you're always grateful because it's what's saving your life, literally.
Mm. And I think one of the visible signs that we all see for someone that has gone chemotherapy is their hair falling off. But are there other things that go on that we do not see on the outside?
Oh, yes, yes. This is, like menopause. Everyone talks about menopause and they know hot flushes, and that's it. They don't know anything else that happens with it. And the reason I'm bringing that in is because when they started the chemo, they induced menopause. So it
Oh,
was
the
like
induced
double.
menopause. Is that the
Yes.
only way?
It's chemo is anyway going to go and destroy everything at a cellular level.
Mm.
So um, it's the best course of action.
Wow.
So so it's a double gift. So you have the chemo effects and the menopause effects. So yeah, yes, everyone does know the loss of hair, but alongside it, you're taking a lot of steroids um, and antihistamines to counter the effects,
Mm.
and so that with along with the induced menopause is wreaking havoc on your hormones. So you're going through this emotional roller coaster. Your muscles and bones, you sort of become like these skeletons in a bio lab, or
Mm.
a diagram which shows all the veins and muscles. You begin to know every part of your body because you will
Mm.
feel every part of it. Your nails turn black, toenails just fall off. Uh, yeah, you can't taste stuff, or you can taste certain
Mm.
things, like, in a dish you love. Suddenly, you will pick one ingredient and it, it becomes unbearable. You just cannot. I love coffee, but I had to stop coffee. It just became too strong for me, no matter how light I made it.
Wow.
Yeah.
A lot change.
So, yeah, yeah.
So,
And so your eating habits change. You lose your appetite. Your body hurts. You get tired. You get really tired. Like
mm.
you'd be fine, and then suddenly in 1 second you just have to collapse and go to sleep, or just lie down. You just get so
Mm.
exhausted. So yeah, all of those things happen.
Okay. So, Coach B, how was this for your family?
Of course, it was really hard for them, um, as you can imagine. Nobody's ever prepared to hear this news, but we
Mm.
were blessed with really good doctors who were able to put it into perspective and show us, that we're really blessed to have found it early,
Mm.
And as one nurse told me when I went, look, if you had to get cancer, you got the best of them all, because breast cancer has the highest rate of treatment and being cured.
Mm.
So, that in itself is something to be grateful for.
Mm.
So yeah, it was hard for them. And then, this whole thing about being positive when you're going through this. So it's pressure on them to make sure
Mm.
they're always positive, and they're seeing you in a shape and form that they've never seen you
Seen
before.
before, yes.
Yeah, it is. It's hard. It's hard on everyone. Yeah, when somebody goes through this, they don't go through it alone. The family goes through it
Mm.
for sure.
Mm. Wow. That I'm not sure, but when a family member is unwell, even that alone is enough stress. But to take it a step further, cancer is something that is really scary because reading about it, they're not even sure what causes cancer.
Yeah,
So
that.
how then do we even move from diagnosis to healing? And
So
unfortunately, not
again,
everybody survives
yeah,
um
yeah, that's also
cancer.
true. And I find a lot of women saying, I'm scared to go do a mammogram because I'm scared of what the result will be. And I have to, it's a bit, it's a bit silly, because if it's there, God forbid, if it's there, it will continue to be there whether you go check it or not. So you
Yes.
might as well go find out early, and then you can do something about it, because this is treatable. It is treatable if you go and get it catch it early enough.
Hmm.
So like I said, I was really blessed with the surgeon who, when I when she said we need to do the biopsy, and she could see on my face I was like really shaken up, and she said, no, don't start crying now, we don't know what it's going to be. It could well be nothing. If when the results come, God forbid, it is malignant,
Hmm.
we'll cry. You and I will both cry for 5 minutes, and then we will stop and we will plan how we're going to tackle it.
But
So,
could be
yeah,
how do we overcome the fear of getting checked? Because
I think you
if you
have to
don't
just
check, you
name
don't
it.
know and you're
Yes,
okay.
yes. It's
But
it's like
then
a
that's the
toothache.
risk.
It's like a toothache, Brenda. You ignore it, and then you do some home remedies, put some clove or clove oil, and whatever, get through it, and then it comes back worse and worse, and then finally you can't bear it, and you go to the dentist, and the dentist says, now I have to remove it. If you had just come a little earlier, we could have done a root canal, or whatever. Root canal is a painful process, but we could have saved your tooth,
Hmm.
right?
Yes.
Take your car. You hear a funny noise when you're driving your car. You say, I'm scared to take it to the garage, because what if he says there's something wrong with it? So it's better if I don't know that, and I'm just going to keep driving.
Hmm.
And what's going to happen? Middle of
It's
a
gonna
busy
break down.
highway, you're going to have a breakdown, and God forbid,
Yes.
something terrible happens, right? Then you go to the mechanic, and he is going to blast you for not coming in earlier, isn't it? So
Yes.
possibly it could be something that could be saved at very low cost and with little time in the garage,
Hmm.
but you've taken it so late that now you have to buy an expensive part and replace it and leave your car in there for a week, right?
Yeah.
It's exactly the same thing. So you have to ask yourself, which is worse, me going to the doctor, I mean, going and doing the mammogram, which may be a bit physically uncomfortable. And I must
Hmm.
tell you, it is no longer the painful thing that it used to be. It is quick, and it is really just a bit of discomfort. So that, and the possibility that there may be some bad news against, because I went through the discomfort of doing the mammogram, and if the bad news was there, caught it in time, I'm now going to be treated. And given a certain amount of time and treatment, I am going to be alive and healthy again. You have to weigh the two.
Mhm.
If I
So
feel
then again,
the
it means
risk
that
of,
early detection
yes,
saves life, right?
without a doubt, without a doubt. I do know, because I went around like a public safety announcement telling everyone and forcing everyone to go to mammograms. And a friend of mine had her friend's sister who did an ultrasound. They found something. They said, we need to do a biopsy. And she was scared and she said no. And she put it off. And then 3 months later, it began to physically, she could feel the lump, and then she got scared.
Oh,
And it was stage 3.
wow. That's
Three
far
months makes
advanced.
all the difference. 3 months makes, she would have caught it in the early stages.
Hmm.
So when you just have to ask yourself, does it make sense to me to take that risk? If I'm willing to take that risk, by all means put it off. But ask yourself, if I could save my life by going now, does that
Yeah.
change? It's a simple
I,
question.
I remember you in one of our conversations, you said the fear of the unknown doesn't prevent you from getting sick. If you already have it, not knowing doesn't change the situation. It
Exactly.
only makes
Exactly.
matters worse.
Yes, it's an ignorance is bliss situation. You are continuing happily because you refuse to know, but whatever is there will continue to be there. The disease doesn't say, oh, she doesn't know about me, so maybe I'll just go away now. If it worked like that, I would say, yes, ignore it. But it
Hmm.
doesn't, right? It's there and it's growing and it's getting worse. So just
But
go and get.
how do we face this fear with positivity? You know, it's like you're
Like
going to
I
the
said, Brenda,
slaughterhouse, not knowing what is going to come off it. But how do
That's
we face it?
that's the thing. That's the thing. See, the difference is the slaughterhouse is not the right word for it. You are not going there to die. You're going there to save your life.
Yeah.
You stay at home and refuse to do a test, that becomes a slaughterhouse because that is guaranteed death. If I stay here and refuse to go and find out what's happening to me, and God forbid something is that's going to get worse and reach a point where they cannot treat it, which means I will die.
Hmm.
But if I go and find out, there is something that can be done and I can catch it early enough. Nowadays, we live in a time where if you catch it early enough, it can be completely treated.
Hmm.
So it's exactly using wrong words like that that put people off. You are not going to a slaughterhouse. You are going to the house that is going to save you.
Hmm.
So that is what people need to consider. The result isn't something that lies in the hospital. The result is in you.
Your body.
Wherever you are, your result, you're carrying it around with you. Going to the hospital just lets you know if it's there or not. You're not going to go there and catch cancer and then they tell you, oops, you came here and now you've got cancer. We're so sorry. That's not how it works, right?
Hmm. Yes. So most people, right, feel that if there's no lump, then there's nothing wrong with me.
Yes, that's another. I mean, that was a big surprise to me as well. And I told the surgeon. I mean, I said a few weeks back I had my gynae do a physical check as well, and she's experienced. And my surgeon said, yeah, and it's not her fault, again because it's small and it's so deeply buried that it isn't showing up on the outside. So that is by no means 100% you know guarantee that there's something. So people just think, I if there's a lump there's something. That's not true. There could be something without any external signs.
And I'd never really heard about any connection with having a pap smear linking to,
Yeah,
finding cancer.
hard way to find out, right? For
Breast
me.
cancer, especially because
Yeah.
everybody knows that pap smear is just to find for
If
cervical
there's
cancer.
anything yes, or any gynae issues, uterus
Yes.
issues, things like that. But this is why they say, listen to your mother. Mother knows best. She would just say, just go do the pap smear. And I was so grateful I did that because, it set off this whole chain of reaction, responses rather. And I think also that I had a doctor who she talked it down. Abnormal cells, it's normal, if you've had a UTI, whatever, but she didn't ignore it. So
Mm.
when I looked it up and I said, doctor, I see that people are saying that if you have this, you should do that. And she said, exactly. That's what I would recommend as well. Because you go and you find out there's nothing, then that's great, right? You have peace of mind.
Yes.
And then, once I did find out there was a thing, she immediately pulled every string she had to get me the appointment with the surgeon, because God bless her, she is really the best. And she got me an appointment the very next day. So having supportive doctors really, really helps. And like I said, this surgeon has the same approach to life as me, because I like to take charge and I like to have an action plan. I can't just say, let's see, wait and see. Um, so when we found out, she gave me a few minutes to just collapse and have a little cry, and then she said, okay, so now let's look at what the situation is, and then we'll work out what the plan of action is. And she had such clear oversight of what she's going to do, and
Mm.
it made my husband and I so calm. We felt like we're in safe hands, somebody
Mm.
who
Good
knows what
point.
she's doing. And she made it so clear. She didn't dumb it down. She told us exactly what is happening, and why we are doing whatever it is we're doing.
Mm.
So it was just the two of us who went to get the result. My older girl was at home. My younger one was away abroad studying. And we didn't tell her because she had her final exams and thesis, and she
Oh.
was so she was mad at us, I think, for a year after that for not telling her till she came home. Um, and the older one was messaging and, like, what's the doctor saying? And we just said, we'll come home. And then we went home and told her, of course, she was really shaken up. And
Mm.
then for the first appointment after that, I took her and went to the doctor so the doctor could talk to her. And the minute she finished, she turned to me and she said, okay, Ma, I can see why you're so calm now. She really
Mm.
put things into perspective, and you feel like,
Mm.
okay, it's happened, but we're going to get through this and we're going to get over it. So I think the positivity and the hopefulness begins from that point on. So you approach it. I give the example of, for me,
Mm.
being an NLP coach, being an energy healer, I know how much words matter and how you frame things, right? So um, it's like a sort of meteor that just
Mhm.
bounced into my orbit and bounced out. It was not something that was coming and staying with me for life. It was not something that was mine. It just happened to take a deviation on its route to somewhere and out. So that was it. It was just a phase that I was going to go through in my life. And that really helped.
Mm. Yeah, I think if you see a situation as a phase that will pass, it helps you to adjust and also be more positive about getting through it and then putting it behind you.
Exactly.
So, could we, for the chemotherapy, were you admitted in the hospital or were you going from home?
No, no. Chemo takes around half a day.
Hmm.
So you go once a week. So for the
Okay.
first 12 sessions, it's a combination of two. And the first one, they need to put your hands and feet on ice. Some people wear an ice cap
Oh.
to prevent hair loss. Apparently, it can save up to 70%. So I gave it a shot. I suffer from claustrophobia, and that cap is really tight. And when they started putting it, I like, you know what? I'll just lose the hair. It's okay. I can't add this stress to the whole thing. So the first 12 are a combo of those two, and then there's four of AC, which is another one, which is the really strong one. That's the one that you know the first two take off the hair on the head. This one wipes every single hair from the rest of your body. I've done
Wow.
that. All of it is gone with those four. And with those four, it's again, you go in for a few hours once a week, but for 2 days after that, I would have to go for hydration,
Hmm.
uh, because it is an intensely dehydrating
Hmm.
round. So if I go on Wednesday and do the chemo, then Thursday
Chemo,
and Friday I have to go for an hour of
radiation.
hydration. Yeah.
Mm.
And also, yeah, your immunity becomes zero at that point. So they would also put the immunity patch. So uh, you'd have one which would go off, like they give you an injection while they're doing that, and then 24 hours later the patch would go off, so you have protection. Then you'd have to wear one on your arm for a few days after that.
What was the emotional? Where did you have those low times and low moments, and how did you deal with it? Because I'm sure a lot was going on with you, and at a point, I'm sure you would have gotten tired, or you would have, you would have been weary. How did you get through the low moments? And your friends, your family, how were they
Yeah,
affected?
yeah.
How were they there to support? You didn't know exactly what to do to support you, or they were just, or you
uh,
told them, don't cry, don't come, I'm okay. How did you deal with
Mm,
all of that?
yes, actually, when I found out and I told my friends, and then everyone wanted to come home to visit me, and I said I'm so sorry, and even family, and I said I told my husband I can't, I don't like this idea of sick visits,
Mm,
because I had sort of decided that I'm not going to think of myself as a patient. So I told my friends, you know what, we'll just go out and meet for coffee like we normally would, and I'll just meet all of you together, and there's no need to come and visit me at home. And we went, and it was just, a very normal gathering, and we were laughing and joking. And in that relaxed setting, I was able to educate them on what is going to happen and explain
mm,
it to them. And so they treated me just normally,
normal.
just laughing and thing, and that's what I needed. One friend couldn't come, and he messaged me, sent me a voicemail, and he was crying, and he
Oh,
said, I can't, I can't handle this. That's why I couldn't come. But I am really so upset. So I told him, I totally get it and I appreciate the love and concern. But if you don't mind, hold off coming to meet me until you are able to just be normal with me. Because
mm,
right now, I do not want to be surrounded by anyone who's crying or thinking I'm going to die or something like that. I just want people to treat this like it's, anything else, a cold, a fever, whatever. And he said, yeah, fair enough, okay. And there was, at a certain point, he was able to join the thing and start teasing me. And when I posted the picture after I lost my hair, and he was saying, now you've got to do this and be Dr. Evil. So so it became it was they check on me regularly, and
mm.
whatever, but everyone would make sure that they just stay positive.
So, like I said earlier, one of the physical changes is the hair loss.
Mm.
How was it for you when your hair began to fall out?
Ah, that was the hard part. It's coming, and in the hospital they sort of prepared me. They said, it's easier to see the hair falling if it's short. So why don't you cut your hair? So after the first session itself, so I went the very next day. I had hair around this length. I cut it short, and then by the second session that had started, she said, I think shorter than this. So it was like a buzz cut. And I was saying that's my, who's the Mission Impossible guy? Tom Cruise. So that's my Tom Cruise look.
Mm,
And then after the third session, it was just falling out in clumps. I think that's the point. That was the hardest for me because it was just patchy, you know. And then my daughter said, you know what, let's just shave it off. We don't need to wait for it to, because it's this patchy look that is upsetting you.
mm.
So she just took the razor and we just shaved it off. And instantly I was okay because I really did look very cool with a bald head. So, so the minute it was like I took control of that situation. So waiting
Yes.
for the head to go, so when I talk to people who've been diagnosed now, I just tell them. And a friend of mine did this recently, and she said, "You know what? I heard you." So the minute they started treatment, I just shaved it all off so that I've spared the falling bit. And yeah, and then I never covered my head. Um, unfortunately, it didn't stay nice and smooth and looking very cool for long, because it there was an allergic reaction which started showing up on my head.
Hmm.
But I just chose to keep my head uncovered, because I mean, it is what it is. And for me, in movies and all, when you see cancer patients, there are always these people who are dying with their hair covered in a bandana,
Yes.
and I was like, no, that's not me. so
And
so
talking about that, when you watch these movies, right, the atmosphere in the chemo wards, I don't know,
Yeah, 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 yeah. It's yeah, exactly. So
is it the
when they,
same or is it just the
no,
movies?
no,
Is
no,
that
not
how
at
it
all.
is?
Because when they said no need of chemo before surgery, I was so relieved. I was just telling my family, my God, thank God, because when we're going to the doctor's on the right and the left says chemotherapy wards, and the doors are closed. And I used to just look at it and imagine like this dark cave of misery and suffering. And I said, oh, thank God I've been spared that. And then when they said, oh, now you do need chemo, I was like, oh my God, I'm going to go in there. And it is without a doubt the most cheerful ward I have been to in my life.
That's surprising.
Everybody from the cleaners, the nurses, the lab technicians, the doctors, they are so cheerful and positive and just normal. Nobody is looking at you with pity or, like sympathy or whatever. They're just like, ah, it's, you're here, you're in the process of getting well. That's it. And
Mhm.
there's laughter, they're joking amongst themselves, they're joking with you. It's just so upbeat and positive and nice, and you keep going around. The same time you make friends, and time to time we'd take treats for everyone, and somebody else would bring treats. And so on the last evening we were going, my daughter and I were actually like, you know what, it's like leaving school or something. You're a bit sad that you won't be seeing these people again. It's yeah, it was. And then I did that was in City Hospital, and then I did my radiation in the Advanced Cancer and Oncology Center. And they're also so cheerful and nice. And on the last day of radiation, I remember I they finished the dose, and it just hit me, because it's been a long 8 months, and this is the last of the treatment, and I just broke down on the radiation table. And when I came, by the time I got dressed and came out, the head of the department had come running. She's like, what is this? Tears? Are they happy tears? And I said, yes, they are. And she gave me this big hug. And then all the staff came and hugged me. And then the patients who were waiting for their thing, all of them started clapping, and we were all hugging each other. And, inshallah, you're next. And then the staff had um, a peace lily for me,
Mm.
and a voucher for dinner for two, to celebrate. And they said, this is your graduation. So you're officially now cancer free, and go and celebrate. It was so joyful. So yeah, I
I think
think that atmosphere of joy and hope is
mm,
very important.
I think that's really good because there's already a lot going on. The body is going through so much, the mind is going through so much. But if there's such an atmosphere, I think it will lift up people's spirits. And like
Absolutely.
you said, they're not going to the slaughterhouse to die, but they are in the
No,
process of recovery.
no, yes, it's where you're healing. You're being healed.
So just like how they prepare you for the entire process before you finish treatment, is there anything that they take you through? Do they talk you through what you're going to experience? Do they prepare you for the aftermath?
They do to some extent. And in hindsight, 2 years later now, I can see why they don't tell you too much, or maybe let you know how long this will go on for, because then you would start getting a bit nervous about it. So
Mm.
they do tell you that the effects of chemo and radiation could go on for up
Mm-hmm.
to 2 years. And so at the 2-year mark, I was all set for everything to disappear. And then some of the symptoms just got worse again. And I
Oh,
was so confused. So I went to when I go for quarterly checkups, and I was asking my surgeon, and she said, it could go up on for 3 to 5 years. So we ease you into it so you can take it a little at a time. Like you said earlier, when you think it's a phase, it's easier. So you think 2 years, you gear up for that and it gets you
Mm-hmm.
through. Well, straight away to think 3 to 5 years is a bit much. But yeah, the effects do continue. So radiation especially will cause muscle cording, and lymphatic issues, which we'll have to keep dealing with. And then you have to rebuild your muscles after chemo.
Mm.
You have to build up the bone density again, your blood count, your stamina.
Mm.
So it's sort of like a factory reset. And then it also depends when you've gone through this, because I do know people who have gone through this in their 20s and 30s, and
Mm.
they bounce back faster,
Mm.
uh, because
So
your
the
body.
age also matters, right?
Yes, yes. So if you, like me, go through it after 50, it will take a little longer.
Time.
Yeah,
Mm. So
but it does.
we
Do get back.
hear a lot about, creating awareness for people to get checked,
Hmm.
early detection, but we don't really hear the backstories of, oh, I'm cancer free now, but these are the challenges I go through. How can you tell us a bit more about it, and how we as people on the outside can help people that have survived cancer,
Mm.
the
See,
post
the thing
effects?
is,
How do, because we expect you to bounce. I think it's just a mindset. You're
yeah,
cancer free now, so let's go back to how things
yeah,
were.
everyone
Bounce
breathes a
back.
sigh of relief, and it's like, ah, she's okay now, so back to
Yes.
normal. Except your normal has changed, right? It's
Mm.
not the normal. You started off by asking me what it was like before I was diagnosed, and what it's like after recovery is not no longer the same. So, um, like I said, all your hormones have been messed with.
Mm.
Your body is coping with this unexpected menopause, and in addition, all the effects of chemo. So it's a bit of a um, hormone stew happening inside. So there's extreme emotional roller coaster. You get anxiety and depression. Um, you're not able to do what you used to,
Mm.
you used to it, and it takes so much effort to get. You have to continuously maintain the effort to build up the muscles, stay, everything takes more time. So people, while you're undergoing treatment, are really good about checking in on you and making sure you're okay. And then now you're okay, so then suddenly, okay, where's everyone, and also, these emotional dips and things like that, it's I can't blame anyone, because we don't know anything about this. Like, I keep telling
Mm.
people, I was like a show and tell, this is my pot, come and feel it. This is where they put the chemotherapy, because I didn't know anything when I started treatment. So I just made sure I educated, so at least people in my circle would be more
Mm.
knowledgeable about this disease, about treatment. So I had to start sharing this, and just telling people, sorry, I really don't think I can talk to you right now, because I might just start spontaneously crying in the middle of the conversation.
Mm.
Uh, and that's so not me. So it takes a while. and
Mm.
and then these aches and pains, so you're just functioning normally, and then suddenly your left arm is swollen, and then it's lymphedema, so you have to do something about that. So these things continue for some time. So knowing
Mm.
that, it's good to just keep checking in on people even after they've recovered. And
Okay.
also, sometimes patients recover and then have this pressure to bounce back and be as normal as possible, as quickly as possible. Now your body has taken a battering.
Mm.
So it's also good to have people around to tell you it's all right to take a little time, it's okay to take it easy, and it's okay if you're not able to do as much as you used to for some time.
Mm.
uh, so that's the kind of support that you can give.
So I'm just trying to link this to COVID. After COVID, a lot
Mm.
changed. We had new normal, and
Mm.
we
Mm.
all sort of just adjusted to the new normal.
Mm.
So, in essence, once you've recovered from cancer, there's a new normal for you now. The way you were before is quite different because a lot has gone through your system, and a lot of changes, and you now have to find a way of living your normal life in a new way. So
Yes.
I guess it means we should be more patient, and we should constantly check in.
Yes.
Once
Yes.
you're better, everybody just zones out and then goes back to
Yes.
how busy they were. But
Yes.
that
Yes.
check-in is still
And
necessary, and all that love and support.
you read my last LinkedIn post in which I said, we have used up sort of all our positivity and energy in just getting
For
through the treatment.
recovery.
So yeah, so it's a bit depleted after that. So patience, you hit the nail on the head. Yes, just be a little
Hmm.
patient because sometimes they might just be a little emotionally needy, or just a little down. So just be a little patient. Yeah.
No, that's quite an amazing story, Coach B. Not everyone lived to tell their story. So I'm so happy that you've
Yes.
survived this and
God's
you're
grace.
educating us more. Are you involved in any awareness campaigns, talks?
Yes, I do speak at every given opportunity about this, and I do post about the not so well known aspects of this.
Hmm.
And I've told my doctors and anybody that to give my number to anyone who's being diagnosed, to their family members. I'm most happy to talk to anyone and share insights so that anything that could help them. Everyone's journey is very different,
Hmm.
but it just helps to know that somebody went through this and they're okay now.
Yes,
Life goes on,
yes.
and
That's
it's good to be back.
that's very important because sharing your story could be an encouragement to anybody, going through the same situation now.
Yes.
And it will be
Because
a light, a ray of hope that, oh, she survived, so I can also survive. There's hope.
yes, so I would say humor plays a huge role in this. um, if you go in thinking this is a terrible thing, and no, it's all in how you view it.
Mm.
So like I said, chemotherapy, yes, it's one of the most drastic solutions and treatments, but at the end of the day it's saving your life. So I would listen to an affirmation, and actually I'm thinking I should do a post and share that, where it says, my mind, my body, and my medicine are a team, we are working together.
Mhm.
So I would just listen to this every night and then during my chemo, so my whole body is receptive to this, because for healing we need to be open to healing. So I
Yes,
would,
we need to be open to healing.
yes, yes. So I would bless every bit of medication that's going into my body. So before we start, so this is going to go and do the job it's got to do without harming anything else. And then I'm accepting you as something that is helpful to me. So this is why I also would like to say, when you're selecting your doctor, please
Hmm.
uh, understand that you need to feel like you both are a team. So I have seen patients who have got a doctor and then they're constantly fighting everything that the doctor is saying, and I can see that they are looking so battered and bruised during the process of the treatment and thing, because it's a mental battle as well, right? So
Mm.
if you're not happy with your doctor, then by all means do your due diligence, go find someone else. When you find a doctor who resonates with you, then trust that person
Mm.
and then leave the treatment to them. Like, we are just going to become Google doctors, right? When we say,
Yes, I was
okay,
just going to say that.
and that
We just
works.
find all our information in
I'm
Google.
not qualified. This is a person who's dedicated half a life to just studying only how to treat this disease.
Mm.
So what she's saying makes sense to me. I agree with her course of treatment. Like, my oncologist is one of the most respected in this region and abroad. So once she said this is what we need to do, I just said, okay, we go with it. And that it takes a whole lot of stress that you don't need to deal with. In addition to coping with this, the last thing you need is to be in an ongoing battle with your medical team, right? So please find a team that resonates with you, that you
Mhm.
trust, lead the treatment to them, and focus on just healing.
Find a doctor that you resonate with, trust them, and trust the process.
Yes.
Thank you so much, Could be. What will be your final words to our viewers, to anybody going through cancer, to anybody that is feeling something but is scared to go and check what it is, and to anybody that has survived and is having such a tough time? What will be your final words to all these categories of people?
Well, to those who are putting off the test, as a coach, I always tell my clients the only way to prevent a regret is to take the action now. That, when you ignore that action, it's going to lead to regret. So
Mm,
just, do I want to say in a year, I should have gone and done the test at that time? In which case, why don't I just do the test now so I don't have to say that a year from now? Do I want to ensure that I am increasing my chances of being treated and of staying alive?
mm,
Then I have to go now, because God forbid if there's something, I will detect it early and then it will be treatable. So that's to you guys. If you ignore it, it doesn't go away, it continues to be there. So just go do your mammogram, do your pap smear, do your ultrasound. To those who are undergoing it, this too shall pass. Make the most of it while you're there. Find the things about it that make it bearable. Use humor. I could eat ice cream. I mean, ice cream is pretty much the only thing I could eat at one point, because I could not taste anything and my tongue was so sensitive.
mm,
Uh, and it would keep getting numb, and ice cream was just, you're like on fire from inside. So
mm,
it was just licensed to eat as much ice cream as possible. uh, so that was nice. And I could just wash my head in a sink. I never have to worry about bad hair days. You just find things too. And I mean, gratitude is gratitude and humor,
mm,
because I just thank God every day for helping me to find it so early, for blessing me with the right medical team who were handling it so well, with such loving nurses who took such good care of me, with family who was my rock right through it, with having medical insurance, which ensured that I could get treated without
yes.
any tension. So, okay, yes, I had to go through it, but then I was going through it with all the
All
possible
the
support.
support.
So I was conscious of that every single second and grateful for it. So the thing is, does this sound like I was a happy puppy all through, laughing and thing? No, I was a complete Debbie Downer at times. And in the beginning, my family would be, everyone gets scared when you get negative. They're like, oh no, no, you have to stay positive or you won't fight this disease. And so I told them, look, allow me to have a meltdown,
Mm,
because it's a pressure release. So I will sit and cry and be depressed and say, why me, and yell and scream and whatever, and then I will stop. If I don't stop, you come and stop me, make me get out of it, but give me the time to have the meltdown.
mm,
So that worked. Then it took the pressure off them to otherwise they also feel that they have to keep me in this happy state all the time. So
yeah.
that so yeah, there were dark days, there were dark moments. And then sometimes your body itself is just going on this, when your hormones, which is another effect of menopause,
Mm,
depression and anxiety for no apparent reason. So speaking about it helps them also to understand what you're going through.
Mm,
Then they're able to be patient or to give you that space. So talk to your family and share what you're going through. And also, fears in the head become amplified if they just kept there. But the minute you share it with somebody, even as you're saying it, it begins to diminish in size, right? And you think,
mm,
oh, it's
yes.
as bad as when it was in my head. And then you're able to deal with it. So don't try and go through it alone. Nobody has to be super strong and handle it all. If you have people who are there for you, please by
Hmm.
all means, allow them to carry the load with you.
Thank you so much, Coach B. So, to our viewers, the fear of the unknown doesn't change the fact that you have a disease. It's better to check because early detection will save your life and it will help you to get treatment. So, our take home today is to make a routine checkup as part of our checkups. Let's add it. Let's not allow the fear to prevent us, from getting checked because that would only worsen the situation for us. The earlier it's detected, then the earlier we can get treatment. And also, from all that you said, your faith, the support from your family, the trust you put in your doctors, and trying to stay positive at every point in time, allowing yourself to experience the low moments, but getting out of it after a while. It's all necessary for the recovery process. Thank you so much,
Perfect.
Coach B, for sharing your story. We're so honored to have you on our channel today. And we wish you all the best as you recover, as you spread the message across. How can people reach out to you if they want to connect, if they want to share, if they just want some sort of motivation or inspiration? How can they connect with you?
I'm most happy to be contacted. I'm Bina Mathews on LinkedIn. I think the spelling is up on screen, right? Bina.
Yes.
And Matthews with one T on LinkedIn. And I'm Coach Bina on Instagram. So
All right.
by all means, get in touch if you need to discuss this further.
All right. So I'll put your LinkedIn details in the description so that if people want to reach out to you, they'll be able to find you there. Thank you so
Oh,
much for sharing your Sunday afternoon with us, Coach Vina.
not at
I
all.
wish you all the best and thank you.
And I wish your channel all the best. I look forward to seeing who your next guest lineup will be.
Thank you so much. So for viewers, those who don't know, Coach Vina was my very first mentor. So the person you're looking at today, this is the beginning. She shaped me and that has brought me where I am today. So she's also a coach. So if you're looking for coaching, please feel free to reach out to Coach Bina. She's a powerhouse. Thank you so much, Coach Bina.
Thanks,
And this
Brenda.
is where we end for today. Bye.
Bye bye.